its capacity to distribute the vaccine.
But right now, the supply is very limited. Of course, we've told you this in the past. CBS 46's Haley Mason has a look at how much vaccine the state will be getting over the next few weeks.
Tracy, we're talking to the governor's office today where they're saying they're out in communities, out in churches, and talking to pastors, trying to build trust in the vaccine. But right now, there just isn't enough to distribute to people who need it.
When it comes to vaccine distribution, the state health department says today it does not have a timeline on when it can move forward past the first phase, 1A, because of such limited vaccine supply. Right now, the state is set to receive 263,325 doses of vaccine every week for the next 3 weeks. That includes the first and second dose. Grocery stores like Publix, Kroger, Ingles, and Walmart are helping to get the vaccine administered, but it's still not enough, said Governor Kemp late last week.
They can do more if they had more supply. We actually talked about that a little bit. They already have plans to ramp that up to be able to do more when that time comes.
Larger hospital systems are also waiting for more shots for patients, Kemp said at the last vaccine presser.
Some of the bigger systems like Grady and others, they literally have hundreds of thousands of patients that are eligible for the vaccine right now that they can't get the vaccine to because of the supply.
As of 5 p.m. Sunday, the state had administered more than 1.15 million doses.
We anticipate that all the districts will use it.
To address scheduling woes, Georgia Public Health Commissioner Dr. Kathleen Toomey says the state's online testing scheduler has been customized to schedule vaccines.
It's the same identical software, just now customized for vaccine. In addition to that, a central call line as well to try to ease some of the burden on the individual districts and counties because they can't always manage all the calls.
The program is set to roll out February 15th.
All those plans going in place, but still a shortage of supply as the state waits. They say they are keeping a close eye on the Johnson & Johnson efforts to get their vaccine authorized under emergency use. Governor Kemp says the latest projected timeline for that could be mid to late March if Johnson & Johnson is authorized. Reporting live in the state capitol, Haley Mason, CBS 46 News.
Haley, thank you.